I would like to now welcome Dr. Edmond to share his experiences, and then we'll take questions. Dr. Edmond.
Thank you, Professor Sunita and Colonel Sanjay and others for organizing this informative webinar. And I would like to start with differing with my previous two speakers, wherein we are batting for lockdown as a solution without being mindful of the implications of a lockdown from a social determinant of health perspective, from a commercial determinant of health perspective, and also from a legal determinant of health perspective. A pandemic of this nature, or even if it's a disaster at large, or even if it's a world war, I mean, we cannot have solutions which do not involve multiple approaches for fighting a common enemy. In terms of development of vaccines, in terms of clinical trials giving results, we have a very long way to go. Let us apply our mind to a simple rational thought. Has modern evidence-based medicine been able to cure or find a solution for common cold? The treatment dictum is 7 days with medicines, 1 week without medicines. So this is how modern medicine has been functioning, and I am a participating actor in it. In terms of diabetes, in terms of hypertension, in terms of tuberculosis, in terms of HIV/AIDS, where are we at large in terms of developmental solutions for the same? So this whole narrative of saying that, okay, 15 to 18 months vaccine is possible, this is going to be achieved, is really pushing in a lot of hope, which probably humankind cannot really live up to. In terms of this, what is workable is to engage in the fact that, yes, meanwhile, while having a lockdown, increase mass testing. I mean, I've been shouting this over the roof, and we have states like Karnataka which become a classical example of chaos. They form committees which have no real-world experience in dealing with public health. We had a cardiac surgeon who was chairing the committee on COVID-19. The other external committee had some guys who were belonging to websites and app development work. So if political loyalty or yes men replace expert governance, I'm afraid we are not going to have solutions in place. Let us also look at how the White House handled the case of Dr. Fauci when he started differing with the trade advisor and others. I mean, you need to really understand this fact that yes, this is a war that has to be fought with public health experts, with public policy experts, with economists, virologists, microbiologists, biomedical product engineers. This is where we have to work as a nation, not just at a federal structure, but also at state level structures. Even if you have few states not complying at a national level in terms of guidelines, this whole exercise is going to fail. And how long can a country like India, where you have migrant laborers, daily wagers, where you have people living in overcrowded slum settlements, how can you really push for lockdown with no clear end in sight? This is having psychosocial implications. This is creating mental disturbances among people. This is leading to chaos in terms of workplace environments. My humble submission to enlightened folks out here, particularly those who enjoy the ears and eyes of policy makers, is to bring in realistic solutions that work, solutions that engage in mass testing, protection of doctors, nurses, the community health workers going to the field, giving them the right kind of PPEs. I'm afraid we still don't have PPEs, and eventually we ended up having 50,000 failed PPEs, which did not even qualify for the quality which came in from China. There is also myths around the fact that yes, goods coming from China have a tendency to spread coronavirus. How are we going to combat these myths? So while we look at it only from a perspective of a win or lose in terms of curative or preventive healthcare, we also need to look at environments encircling this issue. And this is where we need to begin and begin now. I mean, there are still several states who do not do testing. That's why you see numbers every day on the ministry sites which says, yes, these states are doing well, the numbers are low or the cases are contained. I'm afraid we have not tested them yet to call the cases as contained. Also, quickly looking at, I think there was some person who posted what is convalescent plasma. If I may just answer that, it's like in general terms, if you have an army of viruses all over the place, the best thing is to drop an aerial bomb. And this is what convalescent plasma is, where you take the plasma, not the entire plasma, but part of it from a patient who has recovered from COVID-19 and infuse this into patients who are now starting to develop symptom signs and who have been proven to be positive for COVID-19. So this is what convalescent plasma does in terms of trying to understand if it could help in pushing antibodies which can fight the virus. So with this limited narrative, I would also like to request the House, particularly again those who enjoy the ears of policymakers, to communicate effectively. Currently, we are working in 4 states of India and we are also starting operations in 3 other states. But the most shameful situation we face is that IAS officers, bureaucrats are so hesitant to give in writing something which is legally permitted, something that is bound to just enable volunteers to work. I mean, it took a lot of hard work and finally we did reach officials at Niti Aayog, but still at state levels, the deputy commissioners, the state secretariat officials are so scared in terms of saying, okay, work with NGOs. On one hand, you have CEO of Niti Aayog, Amitabh Kant ji, who's encouraging NGOs. On the other hand, you have state secretariat trying to paralyze efforts of NGOs. So where do we draw a line as a nation in terms of policy, in terms of governance, and in terms of effective outreach for those who are really suffering on ground? So there needs to be a serious thought of engagement and moving forward, relaxing the lockdown, mass testing, and not just doing social distancing, but rather doing physical distancing would be a meaningful way to move forward and reboot the economy, while also relying on scientists to do their part. Thank you very much.
Thank you so much, Dr. Edmond, for raising very pertinent and real issues which we are all facing.